smoking a cigarette. How bad that is?
People think that smoking causes lung cancer, which is absolutely true. About 50-60% of smokers develop heart disease. The bad part is that the risk of smoking, say, 3 cigarettes a day is about 80% of risk of smoking a full pack of cigarettes a day.
If we are breathing, inhaling pollutants or not such a fresh air, what is happening to the body and why it needs to be taken care of?
The air pollution has many components, and so when you breathe them, they go and deposit deep into your lung, and that causes changes in the inflammation within the lung, which spreads throughout the body.
While running the marathon, the runners they've gotten cardiac arrest, they've gotten stroke and died.
The reason people have this exercise-induced fatality, there are 2 reasons. One is...
Dr. Bhatnagar, thank you very much for accepting to being with me, and it's an absolute pleasure to be with us today.
Well, thank you for the invitation. It's lovely to be with you.
As we were discussing backstage, whenever there is a topic on cardiovascular system, it becomes almost of paramount importance for obvious reasons, and it becomes even more important when there is an environment as a factor to be included. And you are one expert who's very suitably positioned to answer all of those questions today, and so I thought it would be of great value to discuss some of those in detail. But before we get into that, I would request a small introduction of yours so that some of our listeners who might not know of you here in India would know more.
Yes, so as you mentioned, my name is Aruni Bhatnagar. I've been in the United States from 1985, so it's been a very long time. I was born in India, educated in Lucknow. I got my PhD from Kanpur University. I moved from there to the University of Texas Medical Branch in Galveston, and then from there, I'm currently in Louisville, Kentucky for the last 25 years. My research relates to the effect of the environment on cardiovascular health, and we've been studying both in animal models and in human populations in clinical trials what makes cardiovascular system healthy and what kind of environmental influences can affect the functioning and the health and the disease risk of the heart and the blood vessels.
Awesome. And it's quite a relevant topic for us, particularly because we are runners, and so we are exposed to external environments more often than most other people. And being in metros, particularly Mumbai, Bangalore, Delhi, there has been a lot of discussion and concerns around environment. So I thought we could start by first talking about the cardiovascular system in a very layman's term, the existence and its requirement of it, and then we get to why it's so important to keep it healthy.
Yeah, so from the very beginning, at the beginning of our lives, right from an embryo, the cardiovascular system is very important. The heart is one of the first organs to start functioning during embryogenesis. The reason is that because we have a lot of cells located in the body and they need to have fresh supplies of oxygen and food, and whatever waste they generate needs to be removed from them, and that needs to be a constant issue. So any deficiency in either providing the nutrients to different parts of the body or removing the waste products could result in dysfunction of those tissues. So the cardiovascular system means the heart and the blood vessels, the arteries and the veins are key regulators of the functions of the body. And so they are very, very critical. And so if something goes wrong with them, then it is a very serious issue. And that's why most of the heart disease, most of the deaths now in the United States, and I think even so in India, are because of heart disease and related complications.
Yeah, true. And so if I understand correctly, they are regulators, and also the blood is carrying the nutrients in the entire body, and the cardiovascular system is responsible for pushing the nutrients to the entire body and also removal of the wastage.
Yes, that's exactly right.
Right. So it seems it's quite critical to keep it alive for us to be alive and
Mm-hmm.
be functioning in the right way. Now we are told that we need to improve our cardiovascular health, our
Mm-hmm.
cardiovascular fitness for longevity.
Mm-hmm.
As we start to research it online or see it online, we start to see that your VO2 max should be better. Your you should have a minimum VO2 max of XYZ number to
Mm-hmm.
be considered that hey, you'll be living how long XYZ.
Mm-hmm.
The smartwatches talk about some of these numbers, and we make sense of some of these. Now, so it seems like being a runner is a good thing,
Mm-hmm.
and because we tend to have higher VO2 max.
Mm-hmm.
But then there are external variables that come in play
Mm-hmm.
that may be mitigating, not mitigating, but they rather be neutralizing some of the positive effects of exercise, for that matter.
Mm-hmm.
And this is where possibly comes the question of environment, the pollution, etc.
Mm-hmm.
If we are breathing, inhaling pollutants or not such a fresh air, what is happening to the body and why it needs to be taken care of?
Okay, so let me start with air pollution, and that's what I've been studying for the last many years. So the air pollution has many components, and so what usually is not reported is their fine particles, which are called fine because they're less than an aerodynamic diameter of less than 2.5 microns. So that's the cutoff. It's called PM, or particulate matter 2.5. So it's PM 2.5. And then there are coarse particles that are called PM10, the 10 micron. And then
Yeah.
there is something called the ultrafine particles. Okay, so these are really harmful if you breathe these particles. The fine particles are worse than the coarse particles, and so when you breathe them, they go and deposit deep into your lung, and that causes changes in the inflammation within the lung, which spreads throughout the body. And it's, of course, inflammation is not good. It is bad for your cardiovascular system, it's bad for your heart, and it's bad for your brain. So therefore air pollution causes all these widespread changes in people's health and in functioning. So, but the larger size particles, PM10, which you see, they are not really that bad because they are
Mm.
very big and they could be removed by the nose, and they don't usually get deposited. So they are less toxic if you see really this hazy environment. So that's not as bad as the PM 2.5. But even worse than PM 2.5 are what we call as ultrafine particles, or UFPs. And these ultrafine particles, especially when they are emitted, they are fresh from car exhausts, are the most dangerous. And after some time, these ultrafine particles, as they diffuse out from the roadside, they coalesce, and that creates PM 2.5 and then PM10 and so on. PM10 comes from like the rubbing of tires on the road and from other sources of it. So the different sources of these pollutants. The worst the pollutant you can have is ultrafine particle. And so I would suggest that if you're running, then you should by all means avoid running next to any roadway. Okay, because you should not be within 50 to 150 meters off a major roadway when you're running, because those are the most toxic, lethal particles. Further up, when you have high levels of PM 2.5, those are bad too, but I mean, not quite so bad, but they're still very bad. In India, the levels that you are reporting are something equivalent to smoking a pack of cigarettes every day, because that's the amount of exposure you get. Yeah, people have calculated that if you stop in a stoplight in Delhi for 5 minutes, it's like you smoked one cigarette. So every stoplight you're stopping is equivalent to one full cigarette in the terms of PM exposure. So certainly these things are really, really bad. But what can you do? I mean, there could be some ways to wear masks that you can remove some of the particles. The other problem is parts of air pollution is ozone and volatile organic compounds. So ozone is also high. I think there are reports of ozone in India. I don't know whether they have ozone alert days or not, but here in particular, in United States, we do have ozone action days and ozone days where we suggest people not to be outside, especially people who are sensitive. So we can talk about sensitive groups in a minute, but the idea is that there are particles that maybe if you wear a mask, which is very difficult to wear a mask if you're running. I mean, just
Yeah.
doesn't work. I don't. From my person, I don't think it's fun. But as long as you keep away from the roads, and then you have you're more out, maybe outside more when it's less polluted, the PM levels are lower, it's better. In the US, we have Google Maps will tell you the levels of ultrafine of fine particles, which is traffic. So if you're going to have a jog in the morning, you can look at the app. It'll tell you which routes to avoid. So you don't go running next to those major roadways, and you take another side road, so you can avoid exposure to traffic, and that's one thing you can readily do.
Wow. I think last 10 minutes has been already one of the most insightful 10 minutes ever for me. And so that also means I have a few more questions.
Sure.
Please bear with me for a few minutes as I go through some of the questions from here. One, we said PM 2.5 or below, ultrafine particles are very dangerous. And at home, I have a air purifier, and I always see 2.5, 5, 10, and I always thought 2.5. What will it do to me? It's lesser.
Okay.
and I less than 2.5. I don't even know that it detects or does anything.
No.
Now, the second thing is the moment we say running not close to the roads. I think almost entire India runs on roads. And all of us, we live in cities, and so most of us don't have access to parks, or there are no parks where you can run long enough, unless you're in Bangalore and some parts of Hyderabad, for example. And in Delhi also a couple of parks, but not as easily accessible. Now, so the question is, what do I do in that case? You said you could run early morning, but then I also saw some report that talks about the AQI is a little higher early in the morning. How are both related, like AQI and this 2.55 or anything more?
Yeah, so the AQI is a sort of aggregate measure, and it's a very crude measure to what the levels of air pollution are. So it just takes into account all the other things, as like your gaseous part, your particles and gases, and so on. So it's a very good index, but it's not a sort of something that we use scientifically. We use only that, the PM levels and so on. So I don't know whether there is any reporting of PM levels. You're right. There are very few occasions where you could find places where you can run, like a park, especially in crowded and big city centers like Delhi or Mumbai. Now, but like I said, you could still avoid traffic. And you could go to places there's less. I mean, it's a question of lesser evil, isn't it? So you go to places where there's less traffic compared to the other place which has more traffic. So try to avoid that. And like I said, if you're within, I would say, 100 meters off the road, you dramatically decrease your risk. And so you're not like running on the road, right? Nearby, maybe 150, 200 is a little less. So that, and certainly if you do have a park that you can go jog in, that would be ideal. And I would not suggest that most of the time, because being outside has its own value, but indoor running could be useful as well.
Right. Yeah, that's going to be maybe my third question from now on the indoor running. I have two more before that. One is, let's assume I go to run early mornings when the road traffic is not as much. Now, do I also need to account for when the traffic stopped the previous night? Because there are certain areas where maybe by midnight, the traffic has almost reduced to zero, and you're running early morning 5 a.m. So will the pollution reduce in 4 to 5 hours, and then it's safe to go and run, or it takes time?
Well, okay, so running very early in the morning may not be a good idea. So what happens is, when you have pollution, especially like in places like India, during night, the air temperature cools down. Okay, and when the air temperature cools down, it becomes more sort of calm, and
Yeah,
so the air pollution just stays there. It just doesn't move. Okay, and so in the day, there's a little bit heats up, so the air pollution goes up a little bit. So very early morning, sometimes it may be bad. Here, I don't know whether you can get a hourly AQI, and you could check. Okay, because it depends a lot of very complicated reasons how much it can go up and down. But generally, very very early morning is not. I would think is not a very good idea to be running very early in the morning.
got it.
So yeah.
Yeah, there are a couple of apps that we have access to, but these are global apps, not India based particularly, and
Ah,
there isn't a centralized data source through which we can refer to these. Moving forward, you said AQI is a good measure, but maybe it's a little more crude. And so, if I were to think of pollution and be aware of what to do, what not to do, in addition to what we discussed so far, is there any other way that I can figure out whether whether the environment is polluted or not, like other than just getting the feel? Because I guess by the time if you feel it that it's polluted, it's already too late. It's too
it's too
polluted, I
bad.
guess.
No, there is no, as far as I know, there's no subjective measure
Got it.
of air pollution. So we were not actually, the worst are the ones that you don't see at all. So like here in the United States, we have very low levels of PM10 and even PM2.5. But the low levels of PM2.5, there's ultrafine particles here. We don't see them. The air is clean and nice, but it doesn't mean the problem has gone away. So you cannot see it, and you cannot feel even the worst particles.
Got it. Got it.
And then,
And and seems like not a straightforward. There's no straightforward solution, but I guess one takeaway for sure is not to be running on the road or close to the traffic area, and that could be one way to start. Moving forward, you talked about smoking a cigarette. How bad that is. That what do I mean by this is how much it affects. That is, if I smoked a cigarette, or if I smoke 10 cigarettes, or if I smoke cigarettes for years, what exactly it is doing to my body, what it's doing to my lungs, and what's exactly that is happening. Because what I have seen is people quit smoking, and right after they quit smoking, they think now they're all good, and they will get onto their and hopefully they'll get onto their fitness journeys, etc., and they would want to achieve different things. But it could be that there is something that's brewing under the hood they are not aware of. So
Mhm.
how to first make an assessment of where I stand if I've been a smoker?
Yeah. So smoking has three major consequences: the lung and the heart, and then of course the systemic effects of smoking. So when you smoke, for acutely, the lung capacity decreases, right? So it could
Right.
be anywhere between 15-20%. So if you can try that, if you want to smoke and then run, you're going to be able to run less, right? I mean, you would not be
Right.
able to be as, your performance will decrease and your endurance would decrease if you're
Yeah.
smoking. So that's one thing. On the opposite end, nicotine does sort of is an what we call an adrenergic stimuli, which means that it is a stimulating drug, right?
Yeah.
So people can concentrate better, perform better when they have nicotine. But the other things in cigarettes, like smoke, can actually cause your lungs to be dysfunctional, and so there is an immediate effect in performance and endurance. Long-term effects, people think that smoking causes lung cancer, which is absolutely true. If you're a non-smoker and a smoker, your risk is 10 times higher of having lung cancer if you're a smoker. But only 1 in 10 people develop lung cancer, 1 in 10 smokers. But about 50-60% of smokers develop heart disease. So more smokers have problems with heart disease than even cancer. And it is very insidious in the sense that you have a slow development of the risk factors for heart disease. You might not be okay for years.
Yeah.
So then you would have a progressive dysfunction. The thing with the smoking is the more you smoke, the more you risk for cancer. Okay.
Yeah.
But with heart disease, the more you smoke, then the effect plateaus, and that after some time, it doesn't matter how much you smoke, your risk is always the same. The bad part is that the risk of smoking, say, 3 cigarettes a day is about 80% of risk of smoking a full pack of cigarettes a day. So the cardiovascular system is so sensitive that even you say,
Yeah.
"Oh, I only smoke 3 cigarettes or two," but that's half the risk of smoking a pack. So even small levels of exposure make a big difference. The third thing is that if you quit, the cardiovascular effects disappear over 4 to 5 years. It takes 4 to 5 years for the effects to disappear, and some don't disappear at all. The risk of cancer doesn't disappear, doesn't diminish. Even after you quit, the risk remains because you've been exposed to that. So therefore, it is very risky to start smoking. And even if you think, "Oh, I can do it and quit," it's not a no cost proposition. Finally, I would say that we've seen studies even with vaping that
Yeah.
people think, "Well, I'm vaping, it's healthier for me than to smoke." Well, we're not quite sure about that, but number one problem, especially if you're a runner, is you would have the capacity and your endurance will be compromised much as it does with cigarette smoking. And there have been studies showing that the lung capacity, which we can measure by exhaled amount of air, that the lung capacity decreases both with vaping and with smoking. So,
Wow. Yeah. So, if from this conversation someone decides that they are going to quit smoking, which will be a great thing, and they want to restart, is it safe that they go through certain tests? And I'm talking about generic markers that will at least get them to see that they could be safe to start training and get onto a proper running program or something similar.
well, no, I think okay. If you're running, if you're smoking and you're running and you feel terrible, you should, or even well, you should quit anyway. There's no further reason. It's good by
Yeah.
itself.
Yeah.
If you quit it, I don't think you need a test. I mean, if you are quitting smoking, you should be able to exercise. And the thing is, if you have problems with that, you start slow and you do whatever, you sort of gradually train yourself up to a better level. But exercise is a really good way of quitting, because sometimes people have this urge, and we've had lots of studies in which we advise people to run if they want to start smoking. So in order to overcome the urge, if you start running, you'll feel better, and you overcome
Yeah.
the urge better than if you were just sitting there sedentary and thinking, "Oh, wish I had another cigarette to smoke."
Yeah, no, no, I meant that, say I've been a smoker and non-runner, and then decided that now I'm going to quit smoking and I want to improve my fitness. And
Hmm.
because of that, I want to start running for the very first time, for example.
Hmm.
Could it be that it's already too late and I can't run, or it's going to be dangerous, so I should get myself checked before I start?
No, no, no.
Okay.
And there is no such sort of permanent danger. Like I said, as
Hmm.
long as you don't overdo it. Okay,
Yeah.
that's the thing. The smokers do have a reduced lung capacity. If you look at the postmortem of smokers' lung, they're dark like charcoal, and they're hard, and
Yeah.
and so the arteries become hard, almost like clay. Because if you look at those arteries, they become calcified and they become like clay material.
Oh my
So
goodness.
yes, and so that's the problem. And so you would not be able to run very much. So don't overdo it. But there's no contraindication that if you quit and you want to adopt a healthy lifestyle, there's anything holding anybody back.
Right. As we were discussing backstage, we had an episode where my dad had been a smoker for a few decades, and then with great conviction, he somehow left and started running. That's what he now walks and jogs about 40 kilometers a week, which is great.
Wow.
But then in between, he came up with a situation where he used to get pain in both of his calves, and we discovered that he has had a disease called PAD. And while diagnosing, it was figured that it happened because of smoking.
Mhm.
I thought you'll be in a great position to explain how something like this could be happening.
Yes. So what smoking does is it increases the deposition of fat in the arteries. Okay, so the arteries become clogged, and again, if you see them, they become like a yellow gunk is full of those arteries are full of yellow gunk, and so the
Okay.
blood cannot flow through it because the arteries are blocked with all this fat that's been deposited in them. Okay, so that's the reason you get these problems, and it is the same reason you get stroke, heart attacks, and peripheral artery disease, what we call PAD. The risk for some reason is different. The If you smoke, your risk for having a peripheral artery disease, a PAD, is about 4 times, whereas the risk for having a heart attack is 2 times higher. So the leg arteries are so much more sensitive to smoke. So about 80-90% of the PAD patients we see are smokers, or they have diabetes. They're the two main culprits, which diabetes is the same thing. So it is that that smoking increases the deposition of fat in your arteries in the legs, and that prevents the flow of blood. And like we talked, that flow of blood is so critical for you to be able to move and to run. So if that is compromised, there is not enough blood going to legs to remove the lactate from your legs, and so that lactate accumulates and then gives you pain, so that you would have problems.
Got it. So if that's the situation, I'm sure people who are listening to, hopefully they've not gone through a situation like this, but there could be a condition. If that's the case, while we are not talking about a medical diagnosis here, but will exercise help even in those cases?
Absolutely. So yeah, let's start with PAD. So there is a lot of work that's been done. There is a very famous trial. It's called the Clever trial, and they showed that exercise was almost or even better than stents that are put in the PAD patients to increase the blood flow. Those are little sort of metal cuffs you put in the arteries to increase the flow of blood in the arteries. So exercise is almost as good or better than that as surgical
Wow.
procedure. So and but it has to be regular and it has to be maintained. For same thing with heart disease and the same thing with stroke. Every cardiovascular endpoint that we have seen, others have seen, exercise, it has a universally beneficial effect in all of these outcomes and decreases the risk significantly because it increases blood flow. The heart actually becomes slightly bigger upon an exercise. It is called hypertrophy. So you
Yeah.
get a hypertrophy of the heart, which makes it pump the blood better. So your cardiac output increases, your blood pressure decreases, because one of the things that heart is trying to pump the blood, but your
Okay.
arteries in all your hands and legs are collapsed. So
Yeah.
that's called peripheral resistance. So the peripheral resistance goes down, your blood pressure goes down, and the function of the heart improves. And so,
Got it.
one of the reasons, and this is a side story I want to tell you, one of the reasons I think that running is so good is because we as human beings evolved to run. We when human beings evolved from the apes, we lost
Yeah.
lots of things. We don't have as much hair, we don't have as much nails, we don't have teeth, we don't have muscle. So we are at what they call a degenerate ape. So we lost a lot of things, became very slender and slim compared to
Yeah.
gorillas and chimps and on. But the only thing that we are good at and we perfect at is running. Human beings can run better than any animal on land. We can outrun in our long distance running. We can outrun even horses. We not maybe not
Horses.
that fast. Yes, so we are actually made. We're designed to run, and so if we run, those systems kick in, and you get the health benefits. But that's what the human state is: to be active, to be running, to be walking, because that's what we have been designed to do.
Right. Right. Um, I'm no expert, but anecdotally, I try and tell people, if you can sit, you should get up. If you can get up, you should walk. If you can walk, you should jog,
That's it.
and it always, almost always helps. So
The worst thing you can do is to sit.
Sit.
Yeah, so they call sitting is the next smoke is the new smoking. So
Right.
it has as much risk as smoking. So yeah, we spend, I don't know, 5, 8, 10 hours sitting. That's the worst thing you can possibly do.
Yeah. In fact, two small things we did at work. One was introduction of standing desks, and second we got off our shoes, so people wear just slippers at work, and they'll have their footwear and they'll come and put in the shelves after they wash their feet, and then all day they're just walking around in the office, because we thought your feet should be free. And so we are seeing now people walk a lot more, the team walks a lot more as well. So very tiny
Wonderful.
things that we try to do, but it works.
Great, great. No, no, that's really good. People have tried to do studies in whether standing desks are better than sitting desks. I don't think there's clear data. It was
Right.
not well established. What it's not just the standing, but just moving as a part of everyday life. You've been to the United States. The people here are so obese because they just don't move very much. At least I
Yeah.
think I've seen people in India. There's so much occasion. You go up and down the steps, you walk to the bus stop, you walk everywhere. So there's so much more walking there than anywhere else. But what it is to be continuously moving as a matter, and not like really strenuous walking, just
Yeah.
casual walking would do. So that makes a big difference.
Yeah, yeah, just walking through the day,
Yeah,
that
yeah.
that helps. Um, I've had my parents, and they've kindly agreed to be guinea pigs. I've tried so many of these things on them. In between, mom was she had become diabetic, and we started to work with her. We figured nutrition, but one of the things we did was, can she just keep walking throughout the day? And at one point, her sugar level was crazy, 13.2,
Hmm.
and now
Oh,
she's at 5.1 without insulin, without any medication.
wow.
And one of the things she implemented was just walking all the time. She'll be walking,
Hmm.
and that helps. So we've seen some wonderful results personally as well. I mean, no other data to support, but it has worked for us.
Yeah, no, 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 it's true. So if you are walking, suppose you have pre-diabetes, okay,
Right.
which is like you are at risk of having diabetes and your A1C levels are 6.1 or something. If you walk 30 minutes a day, every day, you can delay the onset of diabetes by 20 years. Okay. And that just takes a very small amount of time, like 30 minutes a day to walk. So it has very, very profound effects.
Yeah. So, since we moved a little to the exercise side, I wanted to seek your opinion in case people do not want to take up running, professional running, not professional, but they don't want to run marathons, etc. That's a different thing. If you were to suggest what is the kind of cardiovascular exercise program that could work for almost all the people from a improvement of cardiovascular system performance point of view,
Mhm.
that will be of great value.
Okay. So I would suggest something very simple. Generally, it's 30 minutes a day, 5 days a week, but that's just that. It doesn't tell you how intense you should be. So everybody should walk
Right.
at least 30 minutes at a speed in which they can talk but cannot sing.
Okay.
Okay. So if you should be able to talk, but you should not be able to sing, and your heart rate should increase, right? At least whatever it may be, it varies from one person to the other. But the
Yeah.
simple formula is that you should have. It's called brisk walking, and it's different from different people. So you cannot tell anybody you should do 3 miles an hour, you should do 4 miles an hour, five. Some people can walk 5 miles an hour without losing a breath, and some people even at 2 miles an hour. So what is appropriate is you walk with somebody and you can keep talking to them slowly, which is fine, but you cannot sing.
Got it. Got it.
Right.
Moderately hard in a way that
That's right.
you have to keep focus and keep walking instead of very leisurely walking.
Yes,
So
right. So but yeah, that's right. Yeah.
got it. Got it. And so it comes to be about 2.5 hours per week approximately.
Yeah.
If I'm walking for 5-6 days, will that be enough for me to just stay fit?
So yes, so there have been a lot of studies. There is one general belief, the 10,000 steps a day belief.
Yeah.
I'm not sure whether there is scientific validity to that. Okay.
It's just marketing. I
I
thought
think it's,
what I
the
read.
Japanese came up with that idea and they sort of stuck and so on. So, but I spend a lot of time, actually, I work about a lot of my time is working with the American Heart Association. And so we sort of test that, but we don't, in the absence of really any other evidence, it's not a bad goal. 10,000 steps is not a bad goal. But, we think that the 30 minutes a day, 5 days a week is really good. I would suggest that's the only other thing we need to do is to talk about resistance training, because
Yeah.
just aerobic training is not enough. And
Yeah.
whatever the reason, whether it's longevity, whether it's cardiovascular health, resistance training is so critical, especially during aging. Even if you're doing professional running, you should be able to have strong resistive training routines built in. So you have to do light weights at least 3 days a week or more, so that you have constant tension. You build muscle, you build bone, you improve your gait and your posture, and so resistance training is so critical.
Got it. Yeah, no, I totally agree. And runners are, I've seen the more they run, at least the recreational runners, they tend to go away from strength training, resistance training, and they would think since they are running, that's enough. But what you're saying is it's a clear validation that makes sense to incorporate some resistance
Right.
training at all, for sure.
There was a recent study about the bicyclers. So, bicycle people who are long distance cycling, they are very thin and nimble, and that's been
Right.
prized in the field. Now they've suddenly realized, no, they really need to bulk up a little, because you need strength for endurance, and so they are changing their training regimen to actually even have some muscle other than just in their legs. You need core. You need a very strong core to be able to go up and down if you're trying to cycle up a hill or down a hill. So they are changing the thinking about, you just don't have to be ultra light to be a long distance cyclist. You also need to have some muscle strength, upper body
Yeah.
muscle strength. Yeah.
Right.
Right.
Awesome. I think that puts things in perspective for people to not only look at aerobic training, but include resistance training. And of course, it doesn't mean that we have to go to gym all the time and lift
No,
really heavy.
No, you don't. I mean, the best way to do this is for your own body weight. So,
Yeah.
first thing is, if you want to do aerobic training, you will have to climb at least 4 flights of steps up and down every day. That helps a lot. Just stair climbing is one of the best exercises. Then for your resistance training, you could do push-ups, sit-ups, or you can do squats and
Yeah.
planks. Or planks and squats are really good. So, of all the exercises, plank is the best exercise to lower your blood pressure and maintain blood pressure, right? And so,
Oh, wow.
yeah, and so those are very critical. Push-ups also would be helpful, and squats.
Now I'm very interested in plank now, because
Yeah.
the moment you hear of any of these magic words, it just makes us very excited. So now, so it's generally just a regular plank or side plank, or what
No,
should one
okay.
be doing?
Side planks are a little difficult for some people,
Right.
but
Right.
a regular flat planks, those are really good. But you have to hold them.
Yeah.
Also, I don't know what you call them, like a squat. So you sort of lean against the wall and you bend your knees to squat. That's if those sort of squats are very good to lower your blood pressure as well. So if you want to get a better blood pressure control, those are two main most beneficial exercises.
Got it. So that's wall supported. It's more like a wall sit, I think we are
Yes, yes,
saying,
yes.
and hold it there.
Yes, right. That's it.
It's one of the most painful exercises
That's
I
right.
have
That's
seen.
right. But so it stretches the biggest muscles of the calves,
Right.
and so
Right.
it opens up the blood vessels there, so it lowers the peripheral resistance, and so therefore your blood pressure decreases, and it maintains well for a long time. So it's really a good exercise.
Oh, wow. Awesome. And I have two questions that I've gotten from our listeners. If any of this is a little diverting from the topic, we could skip. One is here in India, and I think globally as well, cholesterol is considered the culprit, particularly LDL. The moment anything we see written in bold, when we get the report, it just seems something is bad. how do I make sense of my lipid profile and the data and why I should be looking at it?
Okay. Lipids are the most critical risk factors for heart disease. And just a little digression, heart disease, India is one of the countries with the highest rates of heart disease and diabetes. We do
Yeah,
not know why. Even though people in India are much thinner than people in the United States, the rates of diabetes are higher in India than the US. Here, our rates in Kentucky, which is one of the most obese states, about 8%, but even in rural southern India, it's 11%. So there is a very high risk factor in India. The second thing is of diabetes. The second thing is we have in India generally a very bad lipid profile. The main
yeah,
problem is not so even LDL, it's HDL. So everybody has low HDL, and the level supposedly is more than 35 for men and 50 for women. And so you should, if you know that you're less than 35 and you're a man, then you have low HDL levels. Unfortunately, there is no drug that can increase HDL except exercise. That's the
right.
one of the best known. Even if there's no drug you can take to increase your HDL levels. Exercise, and of course maybe a diet that's rich in fish, fatty fish, and
Yeah,
and so that LDL levels. Well, if you have less than whatever more than 150 to 100 levels, it's really bad. And then but even then, there are two types of HDL. There are small particles and large particles. The smaller
the
ones are worse.
VLDL.
Yeah, VLDL. So VLDL levels are increased in part because of your diabetes and your insulin resistance, and because of sometimes because of alcohol, and so things like that. But the thing to really watch is your HDL LDL ratio. And if you can keep your LDL as low as possible, it's very helpful. And suddenly some people have this, especially the internet has created a scare about all the bad effects of statin, but there have been
Yeah,
hundreds of studies that they're not that bad, and they've been very well tolerated. I mean, I've been on statins for 20 years, and it's fine. So there are medications to, if first you want to decrease your LDL and boost your HDL levels, and by all means pay very close attention to your lipid profile, because that is the single most key factor other than blood pressure
right.
that's reflective of your risk for heart disease. The same thing I would say for blood pressure. People think 180 over 120 over 80 is a reasonable goal. That should be your highest. You should always be lower than that.
Right, right.
Yeah.
And I think both together in a negative way are the worst combination
Yes.
to have.
Yes. Yes. If you have high blood pressure and high cholesterol, that it's really, really harmful. Right.
Right. And thank you for picking up the point on statin, because a lot of us here in India, we live in denial. And also we believe that the moment you start a blood thinner, it's not a good thing. If you get on statin, you can never get off it. And there are so many issues. So thank you for highlighting it's not
It's
harmful
not
as what people perceive everywhere.
Yeah, yeah. There is a
Got,
there is a lot of people there in India who are very prone to conspiracy theories, like we have here
yeah.
in the United States, and they read something on the internet. But if you want, you can collect literally a dozen studies with thousands and thousands of people that have
Yeah.
been tested with statin, and it's been found to be relatively safe. Some people, though, can be very sensitive, and I'm not
Right.
making light of that. And so if you have muscle pain, right, you should of course right away seek medical help and discontinue. But I think the number of people who do that is less. In some ways, though, and we've seen this here, Indians are more sensitive to statins than non-Indians. And so if you have a certain dose of statin that is recommended basis on most of the studies here in white population, you might even get by with a lower dose.
Yeah.
So that decrease the risk of side effects too. So you should work with your physician to titrate the right dose of statin for you.
Yeah, in fact, I have a personal example myself. I was put on statin about 2 years ago, and the physician suggested me a 40 mg.
Mhm.
And I think 3 days after, I started to get really, really strong. There's muscle
Yeah.
pain everywhere. I will get fatigued, etc. And then I left it. Then I was visiting a friend in Germany, and he happened to be a physician as well. He checked, they put me back again on statin on 10 mg.
Yeah.
And it's been fantastic since then.
Yes, and 10 mg is almost for you maybe as effective as 40. So 40
Yeah.
is a bit too much. I mean, I'm sure you're talking about rosuvastatin, but so that's
Yes.
what. Yeah. So that's what it would be, that you would lower down the dose to a tolerable dose and stay on it. So,
Yeah. Yeah. No, this has been very helpful for me. I've seen on the numbers also, it looks pretty good. And I did have the lower HDL as well. I had 48, which I thought is low. I should work on it.
no.
And actually, I've been working on it through exercises, and it's gotten better. So,
Yes.
so I'm at
So,
least
so
happier.
you can, on average, if you do rigorous exercises, and especially you're running, you could get
Yeah.
5 or 10 milligram per deciliter increase in HDL levels just by a rigorous exercise. So,
Got it. Now, the second point is also amongst runners, there is a scare because of various close to finish line issues, casualties, etc., that have taken place in the last few years, where while running the marathon, the runners have they've gotten cardiac arrest, they've gotten stroke and died, and because of that, a lot of runners also want to be very careful. And while we have covered this in a few other episodes earlier, this remains very important. That is, are there certain tests that will help me figure out, do I have a coronary arteries disease or something that will be difficult for me to otherwise find out? Because what I've seen, suppose I go for a medical test, on an average, doctor will get my chest X-ray done, then later ECG, and that seems enough. But I'm not sure that's what will help me figure out if I have any blockages, for that matter.
okay. The reason people have this exercise-induced fatality, there are two reasons. One is they have genetic predisposition, and there are families here, families in India, who do have this, and you may not even know. What happens is there is a mutation in
Yeah.
the muscle of the heart, so the heart is very prone to dysfunction. Okay, and so it is prone to arrhythmias. So one thing you can do is, when you have it, they have ECG, you can look for something called QT prolongation. So if your cardiologist does an ECG, they can tell you if you're prone to arrhythmias on exertion. Okay,
Got it.
so those things are usually caught. We are trying to advocate here from the American Heart Association that all athletes should have ECG done, but it's very expensive to screen everybody. So sometimes these kids, they're like 19, 20 years old, they're playing basketball and they just die suddenly or they have a cardiac arrest right there. So that is the genetic predisposition. Now, in terms of coronary disease, usually it manifests later, like in the 40s, 50s, or something like that. So, a 50-year-old, you're trying to run a marathon, you're
Yeah.
likely to have that. So they do stress tests, which is, if
Yeah.
you go to a hospital, they can do a stress test. They can do your calcification. So the best. Not, I wouldn't say the best, but maybe one of the most easier way to look at the risk is to do what they call a calcium scan. It's
Yeah.
called, yeah. So that you do a calcium scan and you can look at your score, and that'll tell you the risk. So you have a calcium scan, you have your cholesterol levels and HDL and LDL levels and your blood pressure measurements. Your cardiologist can tell you very clearly what your risk is. So if you're a
Yeah.
high risk person, you don't exert yourself. Sometimes, though, the other thing is also, now you have smartwatches, and they can
Yeah.
tell you if there are arrhythmias or something is happening. So if you're wearing those watches and if you're exercising, look at that. If your heart rate is going all over the place, right?
Yeah.
Then you need to stop and do something. And so it can actually even give you an ECG. Not very good, but it gives you some ECG. It tells you whether you are or you're not in sinus rhythm, and that's
Right.
another way of monitoring yourself.
Right. Yeah. I think the message is that if you are in doubt, get it tested,
Mhm.
but don't just be scared forever, and
Yeah.
give it what's due. But beyond that, continue and be reasonable with it. One last point, because you mentioned of the point of calcification. I guess this is why statin could also be very important.
Hmm.
That is the soft plaque rupture
Hmm.
issue. it helps by, I guess, hardening the plaque, and that's why statin is also important in case people
Mhm.
have situations, correct?
So statin can even reverse calcification. And so,
Oh,
okay, so it is very good at doing that. It's not a very large effect, but it is a small effect.
sure.
Yeah, and then also it can stabilize the plaque, so the plaque doesn't rupture that easily.
Hmm.
Yeah, but you know what? Some people claim that the best way to reverse your plaque is to go on a vegan diet. So food is
Hmm.
important. Yes, yes. So a completely vegan diet, at least as in small studies, have been shown to only thing that's been shown to reverse plaque formation.
Wow, I'm going to look it up more in detail and see
Yeah,
maybe one of the future podcast topics.
yeah. That's a
Well,
whole different area about diet.
yeah. Well, thank you so much. This has been very enlightening, and I know we started from environment and went all the way to statins, but really insightful. And I know it's early morning, and thank you so much for spending time with us today.
Well, thank you very much for the invitation. It's a pleasure talking to you.
Hopefully, you will speak sometime soon again.
Sure.
Thank you, sir.